Hey guys, because 80 to 85% of American adults suffer from low back pain, I wanted to share a little bit with you about why you may be suffering this low back pain and what can be done about it. It's unfortunate, but most of the remedies that are out there just simply don't deal with the root cause and what's really going on. So I want us to take a look at our model here. And typically this low back pain down in the lumbar area, that's the pain that many people suffer from. And sometimes it can be debilitating. I've worked with clients who have had such severe low back pain they could stand for maybe 5 minutes. And the pain was so severe they had to sit again. And that's typically what goes on. When you have pain from standing or lying down flat, that sort of thing, then that's an indicator that there are certain muscles that are involved that are creating this issue. And I want to show you what those muscles are. So let's get rid of the skin, and then I'm going to start moving down through these different layers of muscle. And as we move down through the layers of muscle, you're going to see how they relate and how it definitely can affect your body and the pain level in your body. So let's start removing muscle layers. We want to go really deep here because there's a muscle and it's right there. That's the one that I want to show you and talk to you about. This is the psoas. And we have a major and a minor. But the psoas, as you can see, it attaches to the lumbar spine, and it's on the side of the spine. And when you look at it from the side, you can see that it's very deep on the front or the side of the lumbar. There are muscles, lots of muscles from the back side that many people are associating with low back pain, but most of the time, if you have difficulty standing, if there's a lot of pain when you stand or a lot of pain when you are lying down flat, this is the muscle that can create that problem. Now let me tell you a little bit about it and what it does. This muscle, you'll notice the path that it takes. And understand, muscles contract, so they basically pull bone to bone. And you want to look at the attachment sites or where they attach to the bones, and that will give you an indication as to what they do. So this muscle, and you'll notice it travels down the path inside. This is your hip bone. So right inside the hip bone, and then it comes right over this part of the pelvis. Let me move that out of the way. This part of the pelvis, it'll wrap over it and then come down and attach on the inside of the femur. And so this is the femur, this big leg bone here. All right. And you will see the attachment site right inside here. Let me see if I can remove any more layers. Okay. So you see, this is the leg bone, and right in here is where it attaches. So the path for this muscle is that it's going to attach right inside the leg and come around this bone and come right up to the lumbar area. So the idea is it's going to pull this bone toward the spine. That's also known as flexing the hip, basically bringing the leg up. So like, for example, if you did a sit-up or a knee-up, that's one of the muscles that are involved, that's involved in this particular movement. Now, what happens with people, especially if you spend a lot of time sitting, maybe you have a job that you sit in front of a computer and you spend 6-8 hours a day sitting. Well, this muscle is in a shortened position whenever you're sitting. And then that muscle will, in essence, shorten because of the shortened position. Then when you go to stand up and straighten that out, you put a great deal of tension or stretch on this muscle. When this muscle is stretched by standing up, then it puts tension on the attachment side, meaning that it's going to put tension on the low back. And what you'll see in many cases is there will be a rotation of the pelvis. It will rotate forward because the idea of the hip flexion, the flexors are so short that they don't want to straighten up. And so as a result, in order to stand up straight, you end up arching the low back and standing up really tall, or overarching the low back in order to stand up tall. And so this muscle being tight, being shortened, is and oftentimes, and often is the case, it's the culprit for the low back pain. Now, because of where it is notoriously difficult to get to, as you can imagine. So let's start building out our muscles, and you can see you've got all the organs inside the abdomen, and then all of these muscle structures that are layered on top of it. So we have to be able to get to that muscle. There are techniques that I've developed that have a tremendous impact on this particular muscle to get it to relax, and has been very successful with working with clients. I have one client she's a surgical tech for an orthopedic at Memorial Hermann, and she was suffering severe low back pain. She could only stand for 5 minutes. And she came to see me, and within 30 minutes, we had her completely pain-free. She was able to stand. In fact, she stood and talked with us for a little over an hour. And so tremendous results in turning that particular muscle off. And you can see the access point. The problem with this access point, being able to get to this muscle here, is that we have other structures in this area. That's the nerves. See all the nerves on top of that muscle? And you also have vessels. We've got arteries and veins. So all of these structures here, you certainly don't want to come in here and start doing a lot of pressure. So massage in this area is not recommended because we have a lot of structures that we don't want to damage or irritate. But with the neuromuscular work that I do, it's a very light touch. It's using reflexes within the nervous system that cause that muscle to relax. And once that muscle relaxes, then we get a full extension, and that pain or that pressure that's being put on the low back goes away. So extending this, relaxing this muscle, along with its partner, which is the iliacus, and I'll show you where that is. Let's get rid of some of these structures. Back down in here, you'll see that this muscle right here, the iliacus, runs in parallel to the psoas. And so it can participate in this shortening, and it too must be shut down and relaxed. Again, which is a very difficult thing. Many therapists have difficult time shutting down this muscle simply because of where it is. You really can't get in and do a lot of deep tissue massage or trigger point or those types of things on this muscle. It requires something a little more advanced, more technical. And those are the techniques that we have and that we use within our program, the House X360 program. But I wanted you to understand that this particular muscle is the cause for many people having severe low back pain. And so working back here and massaging all these structures back here are not really going to help that low back pain. Again, you can see all the different layers of muscle structures back here. So if the cause is that muscle that's deep in the abdomen, you're not going to get much relief by working the structures on the back side. You have to be able to get to this particular muscle in order to shut that pain down. So that's what we deal with, that's what we work with. And if you're having issues, we would love to be able to help you with that. You can give us a call, 832-292-9146. We have several different programs to correct this. It includes the therapy as well as the corrective exercises that will help to bring balance to these structures. And once balance is brought back to the structures, the pain that indicates that imbalance will go away. So until next time, hope you guys enjoyed the video. This is James House. We'll talk to you soon.